Hello, this is Dr. Wells with Wells Medicine, and I wanted to introduce One-Day TMS. So we're really excited about One-Day TMS because when we first started looking at TMS, TMS was once a day for many weeks, and I just couldn't even imagine myself as a professional being able to get off and be available to go to an appointment once a day for many weeks. Just for a lot of professionals, that's impossible. So when they created the 1 week and the One-Day TMS, that was something that I knew I would be able to do. And so I was happy to be able to offer it to my patients. The other great change is that when it was once a day, because it takes so long to see a difference with standard TMS, generally in the studies it takes about 20 days, which is 4 weeks, to see some noticeable changes. That was kind of judged to be too long for severe depression or sort of acute suicidal ideation, because nobody wants to sit on that for 4 solid weeks while you're waiting with one treatment a day. Even though TMS was a great option, that just 4 weeks was too long. So when they created the 1 week and the 1 day, they reevaluated, and they now it's clinically acceptable to treat severe depression and suicidal ideation with TMS when you're using the 1 week and the 1 day, because those are so much more rapidly effective than the once a day slow steady treatment. They're so much more rapidly effective that you can treat severe depression and suicidal ideation. So we're excited to be able to offer ketamine for that, which has been sort of long associated with severe depression and treatment of suicidal ideation. And now we can also offer TMS for those as well. So we're really excited about that. The 1 day is a little bit more convenient than the 1 week because it's all done in 1 day. It's 20 sessions, so it's a very long full day. And the 1 week is 10 sessions a day for 5 days. So that ends up being 50 sessions versus the 1 day, which is 20 sessions. The 1 day also includes 2 medications, D-cycloserine, which increases BDNF, which is very similar to the mechanism of ketamine increasing BDNF. And it includes Vyvanse, which is really important for increasing that activation energy in the brain and learning and memory, and increasing that electricity threshold that the electromagnet of the TMS is using. So we're really excited about 1 day and adding that to the things that we're able to offer patients, along with the 1 week TMS and the ketamine. And those are great treatment modalities. We're still waiting on the 1 day and the 1 week for OCD and anxiety and PTSD, but we are starting to see really great benefits with the depression for 1 day. And so we're excited when they come out with their anxiety and OCD protocols for 1 day for that. And in looking at the combinations of these, so they're just really starting to look at ketamine and 1 week TMS and ketamine and 1 day TMS. And they've already seen some great research on the ketamine and standard protocol TMS. So really looking forward to the next couple of years and more research coming out. If you like this content and you have any questions or comments, please subscribe, leave a comment, and we'll try and cover anything that you have questions on, either by replies or in other videos.